Black people have and continue to face mistreatment in the healthcare system. This includes those who take a medical oath of ethics. As we close out the last day of Black History Month, one doctor shares his encounter with the KKK and the challenges doctors face caring for racist patients. Trauma surgeon Dr. Lane Rolling is here with us to share his story. Dr. Rolling, it's always good to see you.
Good to see you, and Super Sunday, Brittany.
And so we're talking about something a little bit different. You know, Dr. Rowland, this story was so heartbreaking to me that you shared, and also very disturbing. Take us back to that moment when you learned that your patient was the Grand Wizard of the KKK. When did this happen, and how did you handle it?
Oh, it was many years ago in Mississippi, and it was a Mississippian patient and stuff. It was very interesting because when the patient came to me, the staff in the clinic were all panicking. I'm like, "What are you guys? What's going on?" I'm a military guy, and told me this guy's the Grand Wizard of the Klan, responsible for deaths and injuries and mistreatment years as the Grand Wizard of the Klan. So I was like shocked, but I think it was ironic. I'm saying, why would the Grand Wizard of the Ku Klux Klan come and see a black doctor? And at the end, I found out the reason why, because of my skill set in surgery, special reconstructive surgery. This guy had prostate cancer. He had his leg was rotting, about to fall off, and just the smell of death was just amazing. That when you look at this type of history of an individual like that, for a guy to come to a black doctor, a black surgeon to try to save his life, I thought that was hypocrisy, because he could have went to all these white doctors that are supposed to be so intelligent. But at the end, he came to me, and it was very amazing and shocking. And this is American history.
Yeah, I mean, and to still fight to save his life, you put all of how you probably felt at that moment aside and went forward.
Well, at the first, I'm a human being too. I think about what a lot of black folks are going through: Mississippi, Louisiana, Alabama, what the Ku Klux Klan did, lynching people, killing people, this white supremacy stuff, and the horror of that, it really, that's really American history and stuff. And as a doctor, I had opinions because based off of his evilness, the racism. Met him in the clinic. It was kind of a tug of war. He's looking at me and he has his white wife there. If you could see the movie Mississippi Burning, that's a typical that white woman hairdo, and and he's in the wheelchair and she starts crying and talking, please save my husband's life. And I might look at this guy and he's just bitter. And I'm looking at him, and he throws out a couple of racial terms, and I turned back and told him, "I'm not the Pillsbury Doughboy or teddy bear. I'm not here to play around with you and stuff, because I have the same amount of energy you have, but you happen to be in that wheelchair, and you're here to for me to try to save your life." And so what I did is I put aside my personal feelings and did what I was supposed to do as being a humanitarian. I took care of this guy and gave him more life, another year to live and stuff. And, but it was just ironic when you look at the racism that we black doctors go through in the United States. When we look at the numbers, only 5% of all the doctors in the United States are black. They talk about affirmative action. That's not really true. And it's the system itself. And it's just ironic to see that occur, that somebody as evil has the ability to come to a black man that he hated to save his life. Very, very interesting.
Just remarkable. Well, really quickly, talk about the patient and doctor relationships. Does racism ever play a role in that as well?
Oh, absolutely. I've had white patients see me. They know who I was, and they see me, and they would get up and walk out of the clinic. This is the part of the system where this is what we call systemic institutional racism, where patients are taught, white patients are taught that as black doctors not very good. And so I've had that experience with patients too, and fellow doctors that were just straight up just evil. But these guys happen to be in the power, when I was younger, to dictate, policies. But at the end of the day, now in 2021, we have a sense of belonging now finally, but we still need to get more doctors, young doctors out there to take care of our people, because we know, the systemic racism where if you are a black baby taken care of by a white doctor has a 3 times more likely chance of it dying. So you can imagine if that's the number, what happens to us black adults, and that goes in part to all the healthcare disparities, because most of these guys look at us like that we're beings, and that's just the way the numbers are. So I think as we get better, and we still try to instill humanity in people and learn humanity, I hope that one day the whole system becomes fair, where people can live a good life and go to a doctor or go to a system and be treated equally. But as at this point now, we still have a long ways to go. And as long as we have good people trying to do the right thing, I think we're going to advance in that way.
That is absolutely right. Thank God for our black doctors, and thank God for the work that you all continue to do. Thank you so much, Dr. Rowling, for sharing your story with us.
Thank you very much, Brittany. And it's a story that I wrote about 6 years ago, and shocked a lot of people to find out that one of my patients was the Grand Wizard of the Klan. And I ended up giving him a year more of life. So I did my responsibility as a human being, as a doctor. And you guys take care of yourself.
You too, and you'll be blessed for it.